Good evening, yɛda Nyankopɔn ase sɛ nnɛ nso n'adom ne n'ahomɔborɔ nti wama yɛ kwan bio na yɛbɛdwendwene nneɛma ɛfa families ɛboa families ɛwɔ yɛasetena mu ne yɛabrabɔ mu no n'atitiriw no ɛyɛ nkɔmmɔ bi a yɛdwene ho afa sɛ yɛkɔ hospital bi a me invite yɛ speaker no ansa koraa na mahyɛ Jemima mahu sɛ wowɔ so enti afei deɛ obetumi atɛn no camera no on na ya hyase ayiwo akyerɛ na ya hase didi nkɔmmɔ kakra mahu sɛ wɔwɔke wɔ ne camera no okay Jemima yɛma wakɔ aba.
Hi, Pastor.
How are you doing?
I'm well, thank you. Good evening, everybody.
Good evening, and thank you so very much. You don't know how much excited I am. Atiefo amutie yen ene anwumre no. Maami obeka sa akire no. Onye obia say your friend Jemima Amankwah. Na bia de ntia mani age ono so ani age no. I am privileged, and as I was privileged to serve Jemima as a pastor for probably 10-11 years. Now I feel proud to say, young people na yes some woman as pastor no. Nyame adom wa hira wo mu nyina the brain no they occupy very, very important dignified positions. And so I'm so excited. Na me hu omumu bia na mani age say God is so good. God is so good. Until na anwumre ni. Nyame hira yen say yenya ba. Sa na meka no betimi aka na sa. With all pride, they say, yeah, ba, yenua, ye mame, yadamfo, Jemima Amankwah. Na, mami or David Jesus say, or ye panika see a pow. So what tea and tamoha? What tea and tamoha not say? What call UMASS medical hospital, a university hospital. Says it will be our one tamoha, the one satellites, units and centers across Massachusetts. Na kasia waya in Tamuha University Hospital. So called emergency in Tamuhona anyway, and we nurse manager. Jemima no nurse manager. Oh. Na me can say ya. Me ya kasache na bia munim di ntia me can say ya na nkrofo fili se okwa asore ya. You Christian you are just Christopher there you are brainwashed munim who. But mbesa meka say Christopher woni made a Christopher nyame akira yen okwa asori a wona wonyimi na so ma ho kwan nyame be kira no ayo kese. So Jemima, I am proud of you. Anytime I come to that hospital I tell you I said it was a big Indiana me dodgy and then on I say Jemima me ni if I say ani Jemima ebedi nkomo the entia me sra no so meboa no me call hospital ho. Na tell be a na asafo baby problem. Na bia or hospital be cry na makoja no. Na ubehu se wo nim what they should offer and I say what they are there, their roles. Yagene ne sa hospital ma banti yemeheme. Enti tell be on say they have to stop everything and then just put their attention on you. One more homo yejuma. And now almost so feel say, yes, I don't know my rights, the privileges, what I can ask for no. I try to be on my frustrated. Na me bo fu, na me nkrofo ko, na me kra me ye ni nurse for no akontokwa. Mind you say, nurse for ni be betima ewunua can be your friend, can be your mother, your aunt, your daughter. And teachers, we all are playing a significant role. Maybe bompaye no maka story bi a me ande be yoye eti Jemima ye mompaye wa ewrade ye ni age na anwumre se wadum ti wa ma ye kwan na ye be hwetwe nkomo kakra afa ekwan ya be fa so na yeso yate se ye yare ana ye busuani bi call facility bi a what we need to know what we need to understand and what we can ask for, who can be our advocate, things like this. The straw said for Jemima so be saying, oh Jesus Christ, demon. Amen. Again, Jemima, me come the ekito my more can no introduce so my introductory words be nafi and let me know never didn't come on. Me call hospital, me call home a doctor, an ophthalmologist. na or specialist for wartime or more research institute binamiko na and then no I busy into one of his associates and all kinds of tests on some young geogram and ne associate na ba na obusabusa me few questions and I'm eating in an my host computer so no be we na I didn't know at least I want to know what is happening. And one said, we're feeling and Jim Krabusana said, or show one of the photos from the photos now you try. And I'm say, oh, this thing still looks like a mountain. I can't feel I'm so okay. I will be we am the bedman and son of a smack baby. Maybe send me the moment, yes, I'm a nom cocoon. It's why I now do baby. And say, no, say, me train a Mac Fred doctor. No, I busy tea. My texting is omra to end. I'm say, look, thank you very much. I really appreciate what you're doing. And I'm say, I have always worked with my doctors because I do believe that we both have to fight the battle together. And anytime a doctor treats me like a patient, I don't like it. I like the doctor to talk to me as a human being with an illness. I am a human being first before an illness. Don't treat me like I'm an illness. In other words, when we say floaters natural. This is what I have seen. This is what I have found. The Matthias said at least, and I want to know. Oh, I'm so sorry. But man can say I always partner with my doctor. We fight the battles together. And so I always ask questions. I want to know what's happening and what were my pressures today? And what did you find in the angiogram? What did you find in the other photos that you took? I'm so sorry. I'm so sorry. You're right. You need to know everything. We will say, I wish I have patients like you. Now I like that. And Jemima, with that said, and what you bring to us today.
Okay. Yes, because it will be mixed. Also being within Jemima, the nurse manager at UMASS, they mainly focus on emergency mental health. I've been in the role for since September formally, but I was intern manager for almost a year prior. So total of about a year and a half, almost 2 years. I've worked at UMass Medical as a nurse for almost 7 years in the ED in emergency mental health. And prior to that, I worked at the Meadows as a nurse. And that's about it for my background.
Okay. You're a married woman, you have children.
I didn't know. Yes, all that extra stuff. Yes. Yes.
Yeah. Okay, Jemima, and Tisania, I didn't come on a fire. No, many you sent me some things that we need to understand. If you are a free one of the Nema or the Bremen so said in common ebe de pa. Na me gonna ho say semi yare. Nema, what types of cases should I bring to what facility? Now, we now the brain. We now the brain say meet me a show. Send us out as our okay.
Yeah.
Purpose of by addresses say. One will send me yare. You won't be brain yare. The first place we go, they say, a beer near emergency.
Yes.
Why is it good? Why is it not good? Why is it helpful? Why is it not helpful?
Yeah, it's not everything that is emergent. That also was we call emergency room. I don't know if you've noticed currently UMass, your wait times are about 15 plus hours just to wait to see a doctor, because a lot of times patients that a lot of patients are coming to the ED that do not need to be in the emergency room. They can go to urgent care. Example, I have a headache. I've had a headache for 2 weeks.
Okay, sorry about that.
No, it's an example.
Okay.
Can you go to urgent care? Is this something that needs to come to the emergency room, or can I go to urgent care, or can I go to my primary care provider? So those are the kind of questions that before so Bitsna came about, you should ask yourself those kind of things. What are my options? How severe is it? Is it chest pain that's radiating? Is it new? Yes, come to the emergency room. Is it like, it just, the oil just splashed on you and you have a burn? Yes, that's an emergency. You need to go to the emergency room. But there are certain, sometimes I feel bad and I catch it later on because I see stuff like my own fellow, like Ghanaians, it's been hurting for a while. And I was like, but why did you come here? Like, call your PCP first. Like I myself, I will use myself as an example, and I say I was running up the stairs and I must have kicked the stair and my feet was swollen, and was swollen for like a couple of days. And because convenience, when I worked in the ED, I just signed in. I said, "Oh, let me just get it done because I'm working." And the doc looked at me like, "Seriously, is this where you're using our resources for?" Because it's not an emergency. Because but if I broke a bone and I was in pain, I should be going to the hospital. So just having that dialogue and asking, what is an emergency? What is urgent? And I can go to urgent care for. What is an emergency? And what can I wait to go talk to my PCP? And a lot of people underestimate that our primary care providers have appointments throughout the days that they can try to fit us in. So sometimes making a call first to your provider can help save you some time, so you don't waste your time in the ED for over 13 hours just to see a doctor, unfortunately.
Okay. That's as my work on last year, 2021, January, me kokoya me ya. And I'm the emergency, so I'm in the thick of COVID. It's now about 16 hours. Now me say, me koko dear, yes. Dear, some of the emergency room, but I'm wondering, say, I walk in and say, me no idea, say, can you come in? Do I have to take it to emergency room? And to be as you began, take us through this, because I like how it is broken down into 3 categories. Now take your time to walk us through. Why is it that you should take this here? No,
yeah, I want to kind of circle back.
Okay.
Pastor, and kind of just talk about yours real quick. So kind of said you had chest pain, you went to the ED and you had to wait some time. Yeah. So when you go to the ED, they triage you. You like the first people you meet is the triage team, and they're going to triage you to see, okay, and give you a triage level. Okay. 5 being somebody we don't need to bring back right away, and 1 means emergently we need to send them back. And when you go in the room, they ask you questions about the symptoms you're feeling. How long has it been? What is your medical history? All that information helps them factor in, is this something that this person needs to be prioritized to go back? Or can this person wait in the ED while we get back people that are priority ones to get back? That's why like sometimes that happens. So I know people comes in like, I don't know, like we have a Simon home. I didn't say it's there's a triage scale that you have to follow. And UMASS recently just actually invested in a system to help make sure that they're triaging correctly and giving people the fair chance. So they're not waiting if they don't have to wait. Yeah. So that's why it seems like sometimes they're trained for so long, and people are passing by us even though you're Bedru Hujaromo. And at that point, you should probably think, if I think a rule of thumb for me is if I'm in the emergency room for more than 5 hours, I need to consider if this is an emergency, because it's not at that point.
Okay. They say, me nice me software. And my bana more triage me. You triage no class.
Oh, triage is the process of determining, I guess, determining what, like, we collect the information that you came with. About hospital. What is your symptoms? How long has it been happening? What are what is your medical history?
Mm-hmm.
Any medications that you're taking. They collect all the information and put it, and then they will decide, say, okay, with all the information I've gathered, what is my priority for the patient?
Okay.
The triage team determines the priority for the patient's care.
Okay.
Right. Based on data.
Okay.
Based on data, yes.
Yeah, member say chaba men can sim this say no. Yem fa na say me ba hospital me kokoye me ya na me pese mo hwe me ntema. Na mo ye EKG na bia mo say no ye normal. Na my house say me woo and no would it change the grade on me say 5 and a 4 and a 2 and a 1.
Not necessarily. No.
Okay.
Not necessarily. So what after you've been triaged, now so what's it, waiting room, and then your symptoms start to change, really, the team will come out. So, like if they have to say like, which is, oh, me woo, and stuff like that, I'm about for a rapid response or something.
Okay.
Will come and they'll assess, do you need to go back right away? Or can you stabilize? I know I've seen a lot of patients exacerbate their symptoms to make it seem like they're going back.
Oh yeah.
Unfortunately, it doesn't, because a lot of times we're getting people that are coming from the community too in the ambulance that are priority ones. You're getting life flight that is coming in that are priority ones.
Okay.
So it's not said like, and no, only one mode of entry into the ED. There's the ambulance bay and also the front. So all those have to be factored into it as well.
Okay. All right. And yeah, now yeah, but list to him. There was really no MC are categorizing and say no beti media call ER. So if we say we can't chest pain, it's no difficult breathing. What makes this different from fever without rash?
So the fever without rash, or like what's different from chest pain with difficult breathing?
Yeah,
is it on new onset?
What makes them different?
These are life-threatening.
Okay.
The emergency, like those ones, you need to open so-called emergency right away because those are life-threatening. Those are right away. If you don't receive treatment right away, there's a chance that you could die.
Okay.
Or serious harm that is, the longer it is, the harder it is to reverse.
Okay. Jemima wa ben pa aka kra no kire se me mi anu ayeti ade ma ho se de wo si kire ade no ma hwe two categories aka ba ko wase ho. Say if I understand what you're saying correctly, so all these illnesses and also types of situations and what ER section hona, they are life threatening. In Tianono, yes, something like you're saying, we can bring them to the emergency department. Whereas at the Awasia, a fever without a rash, vomiting, persisting diarrhea, abdominal pain, wheezing, dehydration, moderate flu-like symptoms, sprains and strains, small cuts that may require stitches. And no life-threatening. The question I mean is Mami Jemima, how do I know say me am abdominal pain? How do I know say e be kume and as in kume?
That's a good question. I mean, there are resources out there. I don't know if we know. There are, most hospitals have like a triage, like by phone kind of situation. You can call to just tell them your symptoms, and then they would tell you whether you should go to the ED or you can go to urgent care, your PCP. And I apologize, I'll get that resource to you to share with people. But I often do that with like my kids if they're feeling unwell and I'm not sure, even myself as a nurse, I'm not sure if what avenue I should pursue. I reach out to them. Like sometimes even if you call your doctor's office after hours, they have a triage team, and you can tell them, this is how I'm feeling. And not this, you give them all your symptoms, and then they will help you decide, okay, go to the emergency room, or no, you can go to urgent care. Or no, just make an appointment with your PCP to follow up. So that's a good way to start. Pastor, to be honest, before you even get in your car and go. Reaching out to your provider's office, even if it's after hours, to see what you should do.
Yeah. Me that's a pa. You see what you have now opened another question for me. One said, I know that it's becoming more challenging to reach your primary care. Let me give you an example.
Okay.
Last week, I sprained my back. And I went to my chat, and then I thought I was setting an appointment there, which the previous doctor I had, when I go there and I send an appointment request, within 24 hours she'll call me. Now I have a new primary physician because the other one moved away from the state. So I don't know if it is the system that's upgraded and it's not working well. I've done it twice since Monday. Nobody has reached out to me. Now, if I'm a person who probably may not know what you're sharing with me, I'll just drive myself to the ER. I think there's a built-in frustration in our system.
Yes.
Okay.
Yes. And Pastor, that is very true. I'm not currently our hospitals' resources are very limited, to be completely honest with you. There is a huge staffing shortage, which doesn't excuse the care that you deserve. You still should be able to get the care, but not having the resources, it really hard to give people what they really deserve, which includes, I'm not sure, because what I'm noticing is every healthcare facility, their my charts differ from like a bit. This is what I'm personally. So I'm not sure if that function is turned on your my chart. Have you talked to your I think it would be worth the conversation with your primary's office, even just the secretary. This is not a doctor's question. Just ask the secretary that I've requested 2 appointments in my chart.
Okay.
Can somebody explain, like, can you help me navigate it or so? And they'll let you know if that's something you can do, because it's a function you were able to do prior, and now it's not. So it's probably something they need to do in their my chart.
Okay. Yeah. And to review quickly, I call the next, the third level now, a year, which means so sports physicals excluding labs.
Yeah.
So be alcohol physicals, right? And your emergency. When you don't go to emergency department. Mild flu symptoms. Maybe I'm as a minimum maybe I'm sneezing a little bit, stuffing nose a little bit. As we are reading from him, and now there's a medical emergency. Into many may summarize them. Come on, yaku some boa be what be na minimum and I am hene ebia na sumo ya me ya so mania ya kokoka kra bia na if you so kra na enya emergency asema and now say me sabia me jonso na I feel pain enya emergency asema won se ninyi na wa chechire mu ase rashes be as a manual gunwa ahono bi won se nwa ahono bi wa no asore no adu emergency room so the okay no na eya hagene esa na ma won mo so bre na adoso nti Jemima, we coming back up here now.
Pastor, I do want to just clarify that. Just know your body too, because any of the urgent care symptoms or the walk-in symptoms can become an emergency.
Okay.
So just know your body, know the progression, and know that, okay, I'm having pain while urinating, but I'm starting to see maybe some blood while I'm in it or whatsoever. You should get it evaluated to see what is happening. But I strongly advocate people call their PCP's triage lines and see what is available to them.
Yeah. Very interesting. Another experience that told me, Bribi, na me drive to Canada. And I'm my wife. And to me, I felt to say, me koko yeme. Okay, I feel chest pain. And now I feel me debate. I can't do my free US. And I'm say, why would I go to Canada? And then if this thing is something serious happening to me, then I go to hospital there. Then I would rather go to hospital in US, me health card and everything. And close to the border, why me catch my wife me cook And then you heard town now when you me catch Siri, a wonderful Siri. Siri any hospital close by, and I see 2 miles. One me exit here. Now a very interesting Jemima said a Kurasi hospital. Any hospital like yours. Me na me gina ho say ebi am yare am drive across outbridge emergency room because as I walked in before I finished registration the nurse now registration they said sir na me kokona me o sir you need to let your wife continue the triage nurse is standing right there for you and now I'm sorry and on me call within minutes now near EKG ni bibia no ma ask you CAT scan. Why? Now I'm making a point and put it in a context because emergency home in Anna. Well, I'm so more about 180 emergency beds, but me call hono the triage area hono ni area no be akrante ho. So and you know answer here. Now I was just waiting for the CAT scan. Whereas I give you me ba mo ho and I said, yeah, still the same chest pain. No, I'll be still waiting for another a couple of hours. And then when I get a chance to be taken inside, I'm in the hallway still waiting until such a time when a doctor will be able to come see me. Put it in the context for us. Why is that hot here?
The volume is not there. They have the ability to take, the beds are available. Bed to patient space is different.
Yeah.
To be honest, Pastor, I'm not sure. I don't have a good answer other than people's preference and name makes a difference to them. Because every emergency department is required to provide life, like stabilizing care.
Mm-hmm.
And if they can't continue, they will have to transfer you. That is an EMTALA requirement.
Okay.
By law. They have to and if they don't have the service, they have to at least stabilize you and then send you to where the next step or the next hospital. So I do not, and I mean, there's a lot of healthcare professionals on here. I just looked through. You guys can feel free to chime in. I'm not sure why that a lot of people come to university for those kind of complaints, because sometimes we will call around and Harrington Hospital's ED will be not as full as university campus.
Yeah.
And you would try to divert people and say, okay, I can't turn people away when they come to UMass. I just want to make, once you get to the hospital, it is an EMTALA violation for us to send you away if we have not given you the stabilizing care. However, you do have the right to leave if you don't want to stay. If the wait is too long, you have the right to leave if you don't want to. But I can't say, oh, I know it's a Harrington, a line, no, A is short, so you should go over there. I can't say that. But I have received calls before people got there, like family, friends, whatsoever. And I would say, well, why don't you try this facility? Well, why UMass is better.
Mm-hmm.
Well, they all have to practice and with the code of, it's a code that they have to make sure that they're giving you the safe care, stabilizing care if you're going to the emergency room.
Mm-hmm.
So to be honest, I don't have a good answer other than I personally think it's just preference. Bigger hospitals, of course, have a lot more resources than community hospitals.
Okay.
And so that play into some decision factors for people, like if they know that they're going to need a scan and the community hospital may not have that available to them. So sometimes ambulance companies will bypass the community hospitals and come because they know that service is not there. Yes. But just a rule of thumb, like any emergency room can provide the same care for you to stabilize and make sure that you're okay, and before they transfer you if they don't have the resources to continue.
Yes, that's a powerful young. Now, Jemima, more multi and Minkasa may be more lines no free break no. Or question Biana, just raise your hands and we will let you ask your question or your contribution. I have a mute everyone and more bit me at the end. Jemima, sorry.
Oh no, I wanted to also go over some of the things that people are entitled to. Oh, okay.
Yes, in the hospital. What am I entitled to? I know it's care, but
well, okay. Well, like you said, you're entitled to care. You're entitled to being a part of the care team. You need to be able to understand what is happening to you. You're entitled to whatever is deemed as reasonable by the care team.
Yes.
For the presenting diagnosis, like for whatever you're coming in for.
Okay.
And with that being said, like sometimes people will come and they would say, oh, my knee hurt. And then they all of a sudden think they must have an x-ray with that.
Okay.
Doesn't necessarily, just because you're coming in with the diagnosis doesn't mean you're entitled to certain part of the treatments for it, because it might not be necessary at that time. And inquiring costs that is not necessary is something that insurance company also monitor. They look at, like, why did the person come in? Was it a justified diagnostic eval that was completed?
Okay.
So that piece of it too. You're entitled to an advocate. You're entitled to speak with somebody if you have questions about your treatment, and you're entitled to answers from the whole treatment team, whether it be nursing, the attendants. I always ask people, and I strongly encourage people, if you're not getting the answers you need from your medical team, from your resident, you need to escalate it up, because there's always somebody above them. There's always somebody that's going to intervene and help control the dialogue so both sides are heard and respected. I am a firm believer in the patient advocate. And a lot of people, I don't see a lot of people utilizing them. To be completely honest, they are very underutilized resource, because the patient advocate's job is to help build the bridge between you and the hospital. They don't work, they're employed by the hospital, yes, but they're there for you. They're there to hear your concerns and say, okay, I don't understand my care. I don't understand the treatment plan that is being given to me, and nobody's helping me understand that. You're entitled to knowing your treatment plan. You're entitled to understanding the care that is being given to you. So if you're not being heard, a patient advocate is going to help facilitate that conversation. And they have helped tremendously for me, my experience. As a manager, when I hear complaints and like concerns, it's always good to have an advocate there to just so they can help build the bridge that needs, so everybody is happy about it. The most important thing I want to share too, like on this platform, that every patient is entitled to privacy. Just because you're Ghanaian does not mean you need to call the world and let them know that that patient is there. I often get a phone call like, oh, well, this person is here. Are you going to go see them? No, I'm not a part of their care team. I'm not going. And I encourage other people to speak it out when it happens too, because it's you have the right to come to the hospital and not worry about who knows my business today. Who's going to know my business? Yes, the care is nice, but like, pray about it. Don't call everybody and let them know. And as a manager, I've had a couple staff come across my table for disciplinary actions because of HIPAA violation. Because it's well intended and you want to do right by the person, but sometimes you have to give the person that privacy. Give them space to be sick. Go through the treatment. And then, yes, send your well wishes and everything. But if they have not invited you to be a part of the care, you should not invite yourself to be a part of the care. Neither should you communicate with other people that their person is there. Every patient is entitled to privacy. And that is one big issue that we have in our community. And it's not for malicious intent, because everybody, it's what, like, and I've got this question from the patient advocacy team. I said, I don't think it's malicious intent. I think people think they're doing right by the person, so we can pray for the person. But we just need to be mindful about that.
Me that's a pa. Many aha walking. Means I'm on a tough of you. The Jemima can say, Soko Hospital. So Akwanya Bia so no, your privacy should be intact. As I say, they maintain a higher level of confidentiality. And this you need to trust them, say. Woman be me omania so mbe keep won sem ho. Nanso ye ne aye ba ho no. Ebi aye busuani me nua madam fo bi ohun mi anu afafo. Hey, sofo amu ada ho mi mpa ye ma no. Wo yes a wo spread obi asem. Nya sa na Jemima ye ken. So on fan smile say frobi na catch them say let's pray for this person. It is good to pray for them, him or her by yourself, but then don't become the broadcaster. Now so have a phone mo afre oh me hu say so for amu ada ha oh so for amu agina ha so for amu me hu no na wo share a hospital atade enye wasem. It is none of your business. Yeah, cannot. If you say minianum so be yare me say me ko ho Jemima ntina me ka say me bo ha me ma hu me minim so betimi aboa me so ame ba ya maka cha nurse for say mo mankrofo me se me yesofo se mo mankrofo se mu se me da ha mo ha nyina ba ye ma o mo se sa me se no makopeda be se nkrofo e baba ba hwe me no mo amuntimi control me kan sa no mo ye ma hwe o enti find a room the time be am de me ko se me ba ho de amenta ma ho na bi ho yi bad bi ho no mda ko sho obi an hunu kra se me ho mo hu se de wo kan no ye nuanom Ghana fo bi ye adwuma wo so ebi amon share da wo ba ya soro no ye pempaibo ye good nanso obi ko hospital no mfa nyawo emfa phone emfro bia na de all can say the staff on also no they because of HIPAA ne hospital mra echichiro say entam obi asem na mfa kwa abontene so it is one mo bi to sa mra na wose bia bananimo a ye discipline wo mo pen enti ade a ehia pa Jemima, let's go back to the advocate. How do I begin? A common, if I can speak English fluently, can I ask for an interpreter? Yes. Advocate. Okay, boy.
Yes. If you are entitled to care in the language you understand, that is by law.
Yes.
So, Obana, so you don't understand something, even if a lot of times you can speak the English, but if they're telling you something you're like, Mentiasi, will be better in treat, you are entitled to an interpreter, whether through an iPad or in person, you're entitled to it. Sometimes family members will interpret for other people. We're not supposed to use family members to interpret. However, I mean, if that's your caregiver and I mean, your identified next of kin or representative, and you're saying, oh, I need this person in case no one can turn me, that's different. But if you went to the hospital by yourself and you're like, as someone can test it, ask for an interpreter. We have to, by law, make it available for you. So even if they say, oh, there's nobody here in person, there's options that are available to you that they have to make sure available, whether it's sign language, and there's languages that I didn't even know existed, but I have to find somebody to make it available for the patient, or because that's their right. And then if you want the patient advocate at any point in your care, you can request the provider or the healthcare personnel to get you the patient advocate.
Okay.
We are required to get it for you if you ask for it.
Okay, Daniel, I'll give you a chance. The all kind of say, if I understand you correctly, hospital no, or my hand will be a ye triane case. Se me here would phobia or casamaphobia or no advocate no. Metimi a busa I can request to say, Mom mammy will be. Na me here see a church as me as a mammy. And as a mom mammy will be son say Dr. Nasmoka, nurse Nasmoka, mentiasi. That's how I'm working on. And teacher say it is a me kind of saying it's something you offer. Oh, into some hospital and some force on your can't maybe I'm say you meanwhile I may not understand what is happening. Okay, what if say I need more testing? Let me give you an example. Recently I was there with somebody and I am not a doctor. You know the situation, so I don't want to but as I look at the situation, the signs that the individual was showing, it appeared to me that if they have to do MRI or CAT scan, it should be a little faster.
Right.
But then I also respect that they are busy. In a situation like that, when even though I'm not a doctor, the symptoms indicate that something worse is happening. What should
in that moment, that's the case where we could have reached out to the patient advocate, because we're not so, and said one whose symptoms and then you're seeing that it's progressing, and you've spoken with your nurse and said, this is my concern.
Mm-hmm.
They have escalated the concern to whoever the next provider in line is, and you're still not being heard. In the ED, you can always ask for the attendant on record. Now, what's happening is a lot of our patients are boarding patients, meaning they're not being managed by the ED attendant, they're being managed by the hospitalist team, which is a different set of teams that are managing the patient. So it gets tricky in that point, because it's like they're managing a whole lot of other people. And so trying to reach them to come down to become, it gets a mess. So the best, honestly, the person, if you can't reach the attendant to talk to, I always go to the patient advocate, because I will get a call right away. Then what happens is the manager will get a call right away from the patient advocate. We'll give the patient location and the scenario as to what is happening, and demand that either myself go and intervene and have the team come together and come up with a plan, or they will give me a time of when they're coming down. If I'm not available, either the nurse manager, they will reach out right away and say, I need somebody to go and talk to this patient. Now, of course, they themselves too, they kind of triage, is this an emergent situation that they need to come down right now? Or is this something that can be dealt with late to like the next day? But it gets tricky. It gets really tricky, but you can always ask for a manager, like too. And then just because we too have an obligation as a manager, if a patient is saying, okay, I've talked to the care team, I'm not being heard, can you help navigate this conversation for me? I'm obligated to go back and get the facts, right? What is happening, what's been offered, and then present the patient's point of view. So if a patient advocate is not available, and the nurse manager or the unit manager or any manager that's working can help you navigate that kind of concern as well. And if that's not available to you, you can always call your insurance company and make the concern and complaints known. Hospitals don't want to lose. Hospitals don't want to lose their pay, if that's one thing. And then I've had insurance companies that, I work in emergency mental health, so patients will call. They don't care. They will call right away and let the insurance company know that, like, I'm being kept here. They're not doing the bed search. They're not doing this. And we'll get a call. We will get a call from somebody just, checking in. That prompts people, that lights a fire under people, like, what's happening? Does it always mean that it's going to answer your question or get you the results you need? Not always. I'm not going to lie to you. It's not always, but at least the conversation is had and it's on record that it's had and your concerns were made known, because we have to document too.
And Daniel, summarize what I just heard now. I think at one point I made the ultimate to me said, the moment I step in the hospital now, I should be ready, said, even when I need an advocate, and I should ask for one. Yes. Brebia na nurse na mi busano and ahana busano.
Any of them.
Any of them. Okay.
The nurse can provide it, the provider can access it. And UMASS, I can speak for UMASS. UMASS have our staff very well trained that I believe anybody can connect you to the patient advocate, but the care team, anybody can connect you.
And Jemima, on my ATA, sure say, so we have a research study, there's something we call generalization. And the information we are receiving here, I think so we can generalize some of them. In other words, apply some of them in other facilities that we may visit. Patient advocate here, extremely important. When you are in a hospital, you are afraid, you don't know what is happening to you, you are nervous, you are scared, you don't know, you don't want to ask questions, you feel probably they will not treat you. We are learning today that it's extremely important that you have the patient advocate on your side. You have it at your disposal. You can ask for one to help you find an interpreter to speak for you. This advocate can answer your questions and fight, quote unquote, for you. It is very important. Daniel, question is saying.
You, Sister Jemima, thank you for teaching us all this. I think I don't want to make it. I want to make it one. How about when somebody have like hiccups?
Okay.
How would the person approach somebody? For example, when somebody have a hiccup.
Okay, Daniel.
Different way.
Yeah, Jemima. Let me say what category? 3 categories. Or C. If somebody has a hiccup, if you are
okay, I was trying to hear.
That's Daniel.
Daniel. So I personally, and again, healthcare professionals on here can weigh in too. I don't feel like hiccups is necessarily an emergency to come to the emergency room for, if it's just hiccups. Maybe call your primary. How long has it been? Have you tried, other interventions that are like a safe within home first? Call your provider if it's there for, because I mean, I've experienced it again personally where the hiccups lasted a while and it needed like something else needed to happen. So calling your provider to start there, Daniel, and just say, so you have hiccups, it's not going away. What are your options? And they will help you troubleshoot that.
Okay. Thank you very much. Poon Patrick, Bachokoswai. Okay, Yenia Patrick, I'm saying Mama Kwan Koswama Sasso. A tear for said I can maybe a beer lines, no Koswai, what your microphone.
You pastor, Eda Sini Jemima, Eda Wasi. Now, so the AC canon, your friend is saying, baby, privacy, any advocate, no. A very important part. Anna, a dear bar, consistua, away, when say, ye Ghana for, and not a corner for. Nami, a dear dibe, beer. Yes, hospital settings, and as a mental health settings, no. So, a cognac, a credi or honor, so you can advocate by asking the team now and then a year, Jumano say, oh, I think some born a bit me decrease the anxiety and also the tension now involved.
Okay.
But the also we say you keep it to yourself.
Okay.
The tia make an son say I happen. Me ye man and me who say computer no so near bo me who say Obi ba ho okuta Ghana din. E ho na me ka so any me fast our case because me so Ghana ni me nim ni pakro no. Kasa ni nyɛ mu nsusu no na abranteɛ no ɔba no ɔsowa edu ɔbɛde nyinaa no obiara feel threatening sɛ akɔ ɔsowa ɔyɛ tuntum deɛ wo ba wa nhwɛ ɔbɛbɛ bu wɔ mu. Okay, and this is mental health side.
Yeah.
Pani ni nyinaa yɛayɛ order ni nyinaa gu hɔ a kyɛ sɛ de bɛwɔ na ma na yɛ de anda. Ntino me ko hwa ni because uncle what about there me ho to me afedi do be can be a man dey meye.
Okay,
Wa hono minim di pakro ni pa minim na wofo no pa nenso so no e bi kwa na wofo kwa nim so ye den wo ho nenso enam hyper rule ntino mentimi am frɛ awofo no say na den e koso e bi si ni pakro no anya den an kan kyerɛ me say me nkan kyerɛ na wofo so ye den wo ho. It is a akonya beba kakra bi dwuma bi ewo bia na dwuma bia ye bia no say ye hospital say ye court say be bia no say wonya akonya say wo hu unue bia na say emra ne ensu kwan say oba reach out to no bo modern say obekọ because nipa we no titiri kromafo no mama mre ne ye de na different ye hwe wo di ban na ebu say bia wo ban we violent enso na nipa ko na onye violent because na me ni mu Edruani a prepare be one in the B52 just a baby. So a branch oh uncle. Yay, I feel me want to me. And I study so can I some enemy far case na me ye. So it's a very important and na see ka say you can seminars I want here say and that translation service in ebu e be a poor that far request busa. And idea back when say, yeah, your vital science requirement. Busa say idea. Are you saying? No, when you're interested in it, you are entitled so much money. Actually, much more.
Okay.
It is very important. And a pastor idea back home say urgent care. No, it save money more than emergency.
Okay.
And he said, if you have a so better urgent care, kwanza. Now, so called urgent care. No, if you say you need higher level service, higher level of care, they will send it to ER.
What can send be now? Me pese Jemima respond to baby kitu bi. Once I want a clinical psychologist, a clinician, into be a bit my hospital and other places. Minim situation that might be similar yet a little different. Say they are now all kind of say some what young fans and me and I'm a therapist. A war facility be. Maybe names of clients be bar. Na me who say or ye Ghanaian. Meet me abwana. If the protocols and the rules and policies will allow me to choose I should be able to offer, say, can I choose this patient and work with them? Because we share common tradition. So I know, which I think is very, very helpful. Would that apply everywhere? What do you take on that?
Not always.
Mm-hmm.
To the extent that, yes, sometimes like even in my department, if we see says, okay, get a name, but getting a good amount of Ghanaians say, and we just see, okay, can they understand English, or do they like sometimes, some people are like they only speak in Tree. That's different. Mm-hmm. Do I know that these are the things that I think I will caution people and kind of factor these things. Do you know the person? How close are you to the person? Because then it's a conflict of interest at that point. Your judgment is clouded by like you're not able to see the big picture because you're like, oh, mini, I want to make sure that this is for them, and like I can't see anything other than that. So you have to be mindful, and you also have to think about the patient's comfort too. Yes. Just because they know you doesn't mean that they want you to be their provider. Mm-hmm. It's okay to advocate for them from behind the scenes, and I do that a lot. That I know this person, and sometimes just explaining where I think your patient is coming from, but still giving you the space to be a patient and not feel like, oh, I don't necessarily want to know your business. I just want to help navigate it. So if you can, if it's okay with the patient, absolutely. But we should also factor in that, is it make the patient comfortable? Is the patient comfortable? Am I too close to the case? Is this going to affect my ability to like make clinical decisions that is going to be in the patient's like best interest, and not because just like but I'm not opposed to it. I just think that there's also sometimes factors to just kind of consider in that situation.
Okay. Jemima, that's a point. No more boy pa. Antipolina Kosona, then the role of the providers. She said we need to also respect them.
Yeah. Pastor, the Jemima can no preface said. The woman about Penny Kwame. Name New York. Ain't doctor now? No about Jemima one. Who saw a gun in I'm slow? And person gun and even whom I don't want that doctor. Yeah, no, I don't want that doctor. I want a different doctor. And after me, let me who said, Nadine was Timmy Cramer, who said, one.
Not by still.
I ain't no correct. Dog can't no correct. Be a while. Ghana college be. Did me price me. Now, me doctor, no, a Korean doctor, what ya transfer no call. Now, me call me nephew see a doctor New York. Timmy, I'm say, how old are you? Or born the age, and I'm so you are just like my nephew, the same age. I don't feel comfortable, so I want somebody older. The mama cry young. And there are factors be on one. It will be our privacy. 1% will be by my friend or friend.
That's a pa and Paulina. Well, what question now? What contribution? Be feel free to now chime in and let's have a very great conversation. Jemima, okay, my who say Auntie Paulina, Penny Patrick's ababiona iPhone be and Saniako, the role of the providers. Penny Patrick.
First time I say, I'm semi clarify kakra wa hasi. Ansakwa na wa penso se bia obi bisan or say oni utimi eka ho asem. Na obi betimi akonipa kro ne nchen. Na wona ko say, oh, you are assume si bi wo hana, am say you crew me, we are okay with that. Ansakwa na why dey. What me ako. And the woman say, we say, Pastor, we do privacy. So you're gonna need, so you're gonna need. All professionals maintain that confidentiality. It's ubia udi sa adieno mo na when you're good provider. And it's it doesn't matter so you're gonna need say nipa kono aye comfortable so be calling China. Practice baby awo yema bruni, do yema China ni bia practice adieno. Now adia ba ko woman say okay many nipa kono. Pastor, to be honest with you, do you know how many people are? They get calm. So them say me beer.
Oh yeah.
What Timmy Chroma Casa or Shimmy and one was Shimmy well. So Omuba can't maybe I can only speak for mental health side, but it could happen to a medical health side too. And so just so your place send me okay, step blah. Oh, that is the best a year. Well, such a corner or comfortable because when you say, we say, person, come for you, be brain, and say, Abraham, do by example, used to say, but when say, me be bad and chair, no, say, or me. First of all, how can you can't say, Mammy and Papa, and come on, me no D. So one can't you be a maybe can't you be under. And better what you are saying, so. Patrol Manuesi.
Question me that's a pa and son iPhone bebano. A confidentiality, I can't do. Me be me ho me get hospital cry. A toda be na a 2 young adults about me for some premarital counseling. The boy hana mama no be a man pastor. We are so as a girl into open bay. One get or doctor and person would the pastor who me my yen. Hey mammy. Ade what ban when you and you have been so better for your free me ho. Then come intro. One more by me for some premarital counseling. I am working with them. If you have anything, pray for them. And Bisaya now, if you say Uninua, it is so cultural war. No. And I know, say, Yana, abilities to outsiders be person who near Kosovo near day. Now, Jemima, you made a point to be now. I like it. I need to emphasize that. Minianum, what can I say? A toda be a community because a Jemima means him, but Unimkrana, a Juma number 1, a Juma man of Quine so begging. And number 2, try to be a yes or based on her position to be able to get you the best care out here. So in such context, no dear, I try to be a boy. And me gidi sani a yes and hey no. And near my entacitas in a year partner, it's me a boy hospital. The iPhone, but your cosway. Okay, iPhone. Okay.
Oh, Pastor.
Yes.
Yeah, nanka me type my question.
Okay, cause
me patrol say simple say Jemima say my by UMASS. That's my who say CNN and also one of the staff from my transportation will be a breaching my confidentiality here. Why am I reporting on and I also hona me uncle.
You can always mail to the manager. And then UMass has a line, and again, I apologize. I should have anticipated this question and made it available. You can always report it to the what is it? I believe the name is like the Information Technology Protection Team, because I even just had to deal with them this week, and they will look into it and find out what happened. So let's say if they used Epic and there's magical ways to find it. And I didn't even know, even if how long did they go in your chart? To what extent? What did they look at? And all those extra things, they will gather all that information. And sometimes the staff didn't even know, say, oh, my click a crown co chat and I just my mouse on a koda hokeke. They can time how long your mouse stayed in one place before you moved it and provide all that information. So Amankwah, if you ever feel like your privacy has been compromised, you should always report it. There is a privacy team in every hospital. Any management member, patient advocate themselves too can also escalate it. And compliance, like there is always somebody to report it to. And I encourage you to report it because they can investigate and find out to what extent the breach of privacy is, and then work towards securing your information. But if it's like an example, if like you said, a tech saw you there, and then they called somebody to say, oh, me who assume that in those situations is like there's no technical piece to it. I would encourage you to talk to the manager of the team of that area, and they have to investigate it.
Okay. That's about the Kwame. A question me coming to be kahon. Be a not one call charter so Jemima. One call charter so Paso can be a one-on-one and now see in the beer. And I be cry a housekeeping. The facts of who saw who know of a form of phobia catcher. So now what can you do?
You, like I said, you can seek out the manager and let them know, because UMASS has actually, I pulled it out. We have a policy against it, and so everybody gets trained on that. So it shouldn't come as a surprise to anybody when they get pulled into the office that, hey, this is a complaint that we received, and this is the avenue that we're pursuing. And usually we have to go through an HR disciplinary process. So I would encourage you to, wherever department you're in, let the manager know, and they will address it from there. That's one of the quickest ways to get your concerns addressed.
Okay, so Jemima, past time I think so. Oh, make him a question no more. Maybe I over down on you now buy and all that. I bet you say or diagnose not a call, you know. Now they're spreading around.
Yeah.
And you know, say that for honor, maybe a Ghana form, you know what I mean, and so on. At that time, you have no number to call, you have nobody, no unit manager to go to. So my question is, how are you gonna make that complaint?
Yeah.
I mean, there's always a way to track like that. When in your discharge paperwork, there's always numbers to call in case you have any questions.
Okay.
In that's one avenue you can make your concerns known. You can always call the hospital's like operator line and ask to speak with the privacy department.
Okay.
And they will triage the call. Even if you don't want to go to, like you said, you've discharged, you don't remember the manager's names, but you just want to make the concerns known. UMASS, if you call the 3341,000 number, you ask the operator, I would like to speak with it's somebody in privacy or medical records, and just give them the information. And this anybody, we're all required to address that. So they will troubleshoot it and get their complaints to the right department to, if it usually goes back to the manager. That's why I was saying, if you can get to the manager, great. If not, they will document it and send it to the manager to address.
That's a pass opening. Mrs. Amankwah,
Yo, Pastor, Yamisha, Mama. The question is, Minya accident, no. Where be a Udi Mechisa? No, was it enka Honor Ben Emerson Hospital. And so who said no. At that time, no. Emerson Honor Naya, my auntie. Almost at the Mitwa Swako Lay Hospital. Emma papa yi bronio ojina me nche saa hwe ma ye hwe me omukotwa me cascan ayini nyina wo di machi saa enso onye me family member enti me hu se no omo bisabisa adentina owani gie wo mai no mti odidi machi saa na nurses no hu se omo look strange ma wo mo se ana na papa ni di machi bana me hu ni se papa no so during that hu se me hia mo me family my into ojira me nche saa ma ye bibie wie kɔpem sɛ ogye me number frɛ me pastor ne me mai ansa na ɛyɛ ya na phone nso dumiɛ nti manya ne number koraa no sɛ sɔke no kɔɔyɛ na mebisa sɛ obi a onim me nanso so that time ɔmaa ne chance na kyɛ sɛ sɛ nkɛyɛ ha hospital kɔmma ne kwan saa na
not necessarily. I think that this is the concern. You don't know the person.
Right.
They have provided enough support to get you into care of people that can support you, but they decided to stay. There's several concerns that they could have been thinking about. Who is this person? Why are they still here? Is this woman safe? What is the relation to this person? Why? And sometimes, like, because they have no part in the care. And you were not able to give them that information that I'm okay with this person staying. So at that point, the hospital is just trying to protect you. There's several questions that could have been going through their heads. Like, is this woman being trafficked? Is there any, like, what are the safety concerns? Why is this person still here? Even though that we have assumed care for him, for the patient, because they're not giving you care. He's not giving you any care. He's not a next of kin. He can't make any decisions for you. He's not a family member. At that point, they are not needed. They're not necessarily needed as part of the care team. And they probably felt they didn't need, like, there was no need for him to be there. There's several factors that play into it. And it depends. And it's honestly also provider specific. The nurse probably was really extra concerned. I've had nurses that wouldn't care. Just all depend, trying to make sure that you were safe and this person wasn't getting anything out of, like, your care, like wasn't getting any of your information, and why were they there, and all that extra factors.
That's a kayen bese 18 minutes. Jemima pesa okasa kakra. I say was we fan kra no. Yes, we are providers. So I think we hospital. There should be a symbiotic respect. Yeah, they respect my providers and almost respect my you can't patient advocate, you can't your privacy and all that. Providers, no, they are there for our good. What is your role? You speak to that. I know it's broad, but because we have on expectations that are beyond them, that it can provide for us right away.
So the provider's role just really, and regardless of the discipline, is just to provide the best possible care for you, the necessary care that you need in that time for you, and just pretty much just take care of you, do what's best for the patient, do what's the best interest of the patient. That is primarily what the provider's role is. Now, the provider is not like the end all be all. They may not know the answer, so they might have to tag in somebody else to get the answer. They might have to phone a friend and say, hey, can somebody come and check in? Sometimes even nursing, I can speak mainly on nursing. If there's any doctors on here, they can also chime in. Nurses only carry out the orders that they have in front of them. So sometimes people are asking the nurse to do more than they can do within their scope of practice. So it makes it hard. And if the doctors don't necessarily feel like it's needed, the nurse can't go ahead and do that. They need it because they carry out orders that are giving. And yes, we provide some like nursing interventions, but it's not to the extent of what the provider wants to, which causes a lot of frustrations because people I want this, but they won't do it for me. Or I just want to drink, but the nurse is like, well, you can't have anything to drink because the doctor wants to run a test. Well, why can't I have just a little bit? Well, because I can't allow you to do that. So sometimes the frustration point comes to the nurse because they're doing a lot of like the pickup work and just trying to make sure that the patient is safe and okay. So, I mean, we're just there to do what's in the best interest of the patient.
Yeah. Let me ask this question. I was your Penny Patrick Sawasubi. say me ba hospital, if I'm in the hospital and I have a situation, if the main doctor who is taking care of me would like to bring a team, like in your facility, which is a teaching hospital or university hospital, shouldn't I be informed and be asked for my permission? Oftentimes, before you know it, you have a team in the room. And that is where they are going to introduce everybody. Already, you probably may not even, that's not a time when you are going to say, why didn't you ask me? You want to be courteous. But shouldn't they inform you before the team barges into your room?
Yes. Like when you're on the floor, you pass the ED, you're on the floor and they're doing rounds. You should be known that you have a care team. You have like the resident, that you have the attendant. The residents have an attendant to answer to, so they're not the end all be all. So ideally, yes, you would hope that they will let you know who your care team is. And at that point, you can let it be known that I'm not comfortable with X, Y, and Z in the room. Now, with that being said, if you're at a teaching hospital who happen to have students, it is to be expected that there will be a student of some sort that is going to be a part of your care. Can you refuse the student to be a part of your care? Absolutely. But I think it's kind of assumed, like we should be asking, but from what I'm seeing in practice, like it's kind of assumed that you're coming to a teaching hospital, you're going to have a student of some sort. You can always say you do not want a student to be a part of your care. In terms of the residents and the attendant, you will have to speak with the attendant and let them know that I am not comfortable with X, Y, and Z being a part of my care. And at that point, if there's an education piece that needs to happen, because they will ask you questions as to why, what's happening, like why don't you want this person as part of your care, and what are the concerns? And if it's something they can educate you to let you know, they will do that. And if it's something that they can support and remove that person as part of your care team, they will also do that too. But you also have to take into account, if you remove everybody from your care team, who's coming? Like if you say no to everybody, who's coming when you're in trouble? So that's a factor too. But if you're going to a teaching hospital like UMass, I'm going to let you know you're going to get a student of some sort that is a part of your care, because that is our vow to the community. We take in students to teach them to be the next person. And a lot of times the students are much more, what is it? They're like very, like they focus on every single detail to make sure they got every information. They're much more thorough than some of the providers, because the providers know, like, so they're just like, blah, blah, blah. But the students like, oh, let me just make sure, and let me check every mark before I move on. And they discuss. Students don't make decisions on their own. They have to go back to their preceptors to discuss with them, like, these are my findings. What do you think? Can I do, like, what are we supposed to do next? So it's up to you. For students, it's up to you, and you can completely refuse a student to be a part of your care. But as a teacher in hospital, you really should take that into consideration.
Yeah,
because that taught me. I was once a student. Like, you're gonna have family members and cousins and friends that are gonna be students that need to be taught. So if you refuse them, the next person will refuse your family member, and then what would you say? And they don't get the experience.
Yeah, and I intentionally asked that question. I'm coming to you because, as you said, I've observed both. The main doctor has the experience. The students, they go by the book. So they take their time. They don't want to make a mistake. They want to make sure what they are saying to you is what is near to accurate. And so they stay close. They're very thorough. And also, if you have a team, we say that out of the multitude of counsel, there's wisdom. You know, the collective brain will help more than just one. Elder, please go ahead.
Mr. Medasina, me the come on, Miss Aston, and some of my can say, won't pay ye a better problem. Let me say, me can't just say, say, the Chia call here, no, say, for attitude and one way, so don't go to hospital with attitude. To say, you say nipa bi wo mo kyerɛ mo ho paa, nipa bi wo mo kasa ho paa. Na no say providers they talk to each other. Eti wudi kama ba ko attitude da ba because oh, he or she is a pain. Na wo mo yɛ nipa.
Mo ma ja hoko na da.
Omo nya onko kra na obi a wo ba bia no aye garden. Eti no omo nyi omo yem se de wo say ko mo yɛ because nipa yɛ nipa. Eti me sere mo. Mama, I stand I will bet my correct me say boy. Don't go to the hospital. Whatever you go with attitude, then we feel not conny and show. Almost say a nice person or be about. She is nice. He is nice. It's not they do extra to help you. Patrolman was.
It's true. It's true, and it doesn't make it okay, but it's true. Because at the end of the day, healthcare workers are also human beings.
Yes.
They have their own things that they're also dealing with. So if I come into work and I'm trying, my job is to take care of you. Like right now, UMASS, we've gotten an uptick in patient assault on staff. And it's becoming an issue we're trying to deal with because nobody wakes up to go to work to get hurt, to be verbally abused or anything like that. I'm just trying to take care of you. So as a team, like he said, yes, we give report to each other. And as much as we educate against it, people's feelings come across in the report that is being given. So if they had a hard shift with you, they will communicate that this patient was difficult to manage. They had X, Y, and Z. Now, it doesn't make it okay. I just want to preface the conversation. But as human beings, it happens, and you don't want anybody to label you because of a misunderstanding. That's why I encourage, if there is something that is happening, and ask questions and let's clarify. If the nurse is coming in too much, ask, hey, is there a reason why you're coming like so often? Can we bundle the care? I want to get some rest. Ask questions to clarify, because there are things that we do, I know, that upset the patient. Absolutely. But if as a team, because we're care partners, right? You and the caregiver are partners. To one kind trauma said, like, this is how I'm feeling, and you just give them attitude. I have to be honest, people will carry it out in the next, like in the report. And then you don't want to be labeled as, oh, that patient, that one.
Yeah.
It will be a bit, and it will pass on easily. And it's like, oh, that patient. Yeah. Oh, no dear. Don't do that.
question.
Okay, we are not Miss Amankwah.
Yeah. Say do what na be a nursing home ye adwuma me de na beto oba rehab. No ye Ghana ni share bisa. Me kochia no fefefe. Na brofo no yo se de mawa no kɔ ne ncha a omusi ofre call light kra omonko. You this side kwa na me kɔ. Ama ye misi onko boa no mame. Yes sir, me kama what say I had the obia omuye nti eya afrɛ me ne side ho we ya frɛ me ne side ho na me kɔ boa na.
Okay, yo, hey, Jemima, question.
So no, and yet because what it did is, and in psych we'll call it, you just staff split.
Okay.
You just created a situation by which the patient thinks only you care about them.
Okay.
And when you're not there, nobody else cares about me, which is not necessarily true. It might be, but it's not necessarily true. And by staff splitting is not appropriate. It's not appropriate because one minute it's hard for all the other caregivers to come.
Yeah. Okay.
Because then the patient will be through how old and someone from me, so I don't care, which is not necessarily always true. So by saying so, like a hard deal, like, oh, you can just easily say I'm one of the staff on the team. So if you need something, give me a call. Okay. But there are other people here too if I can't come. Okay. That's different from saying oh, when would they like we here be out there from Amankwah, because you're not always, and then when you're 24/7. Into any what's the person going to do?
Yeah. Okay.
So those are the part that we have to factor into, like again, it's a well-intended statement because I want to help you. I want to make sure so you're comfortable. Absolutely. But you're not the only part of the, sorry about that. You're not the only part of the care team. You're not the only person that you're Jemima. And I will fee after 8 hours, at most 16 hours. Who's going to take care of them for the rest of the 8? Are they not going to use anything else? So you have to be mindful in how we present things, so we're not creating a situation for our colleagues to come. My team knows that you have to take care of your next shift. Yeah. I always tell my team, you have to take care of your next shift. You have to make sure you're not creating a mess for the next shift. You make sure you're communicating and getting the patients ready for your next shift, because that's how we work as a team. So I shy against it. As a manager, I don't like my staff saying stuff like that. I don't approve of my staff saying stuff like that.
Yeah. That's a mama. I'm say, you so a chief for 5 minutes. That must be brave. Jemima, you see, say, you will have to come back again. We couldn't exhaust all the questions. Mama say confidentiality, no. Me bois papa. BBS you answer Miss Memricky confidentiality. If you say, Jemima, mammy, I will put a question. So, Miss Mamma didn't send him, mamma. Sending in our confidentiality.
You just broke up.
I can ask Jemima, I mean, the Busa questions is, yeah, Mamma, I mean, some. Oh, said, my pa, among them, you're so bad, and they near Gia, the free, where Jemima, yet there was Sipa. And then you rub about Banyan Bibriaka. So, be a question, be a member, we are summarizing, but I think, sir, you would have to come again. Well, I want to say this is just the touching the tip of the iceberg. And as I say, to your boss in the exhaust, if you say you brain no call emergency room, yeah, now you are there with some kind of fear and anxiety be. I say, Tabitha, what question, Anna? Okay. All right. I'm saying my also microphone. And one me who says I'm a hospital. Number one, the providers are there to care for me. They are there for my good. They want me to get well. I should not be afraid of them. They could be friends. I mean, quote unquote. In other words, they are there to help me. And now, number two, no, you have helped us this evening to understand that everybody who goes to a hospital, especially in the unit where you are the manager, they have an access to an advocate. Now, if and when you need it, ask for it. They are very important. It could be something as little as, and it's not even little, getting an interpreter. For the no media menyadio, mumpo bimame, bikrum kasa. They will do their best to look for ubi or kan krum kasa na boa. Yeah, she also say if they come with a team, like a teaching hospital, it is to your benefit. Say you have a team working with you. We work in collaboration with the providers. And we have also reminded ourselves of confidentiality. Now it goes for both providers and me as a patient, and even my family and friends, that as I come there, what I see should be left at the hospital, unless a person has asked me to call people to pray. Other than that, it's not mine to just pick up a phone because I see something and call. Jemima, if you have a concluding, a screenshot, the three things. Just quick and sunny. Here is another one. Be a number be up as a fra. Wait me a friend quick to get the needed help. Massachusetts hanging on, wait me a friend mass help line. Wait me a screenshot now the atoho. More WhatsApp group no Miss Baba Toson Mas and the Abre Munina. And then there is another one. So Let me show the first. I'm saying free. So this one here, I like that one. The way I see Ayono. So it helps you. Say you want emotional, mental health, or substance use help. Your numbers be able to me afraid to get the needed help. It may not be you, may be your friend, your family member, a neighbor, a co-worker, a person you meet at the gym. So having this information with you would be helpful. Jemima, if you have any concluding words before we pray.
Not much. I mean, you can share my number. I'm happy to talk to anybody when they come, just to help navigate the process. Again, I'm not necessarily a part of your care team, so I won't be able to answer questions in terms of your care, but in terms of helping you connect to who you need to, I am always happy to help. So
thank you very much for your generosity to even allow your number to be shared. Jemima, I am very proud of you. The fact that I got to serve you as your pastor, it makes me feel good to see that you are in such a place to help our community. Now, we will invite you again to come and work and educate us. Na onkan mama yemompaye wai erade yedwase se enne nso wama Jemima Amankwah wabekyerekye wunyame wama no nimdeɛ ɔde yɛ adwuma na sesei bia ogina no esombo na ma ema yakwanya se yemu bia akɔ hospital yebetimi akɔ ne nkyɛn na niema yɛnte ase bi biribi a yɛnhunu mu no obetimi abiebie n'ani so amaye enhyira nka odin se wunyame wodo magina baabi a ema yɛnyina nya ho mfaso enti we ask your blessings upon Jemima and family se hyira wo mo ma boa won mo na nimdia wo dia dum wo no mu no wo mo so ntimi mfa mmoa afoforo aboafo a eboa na dwumade nyina yɛde wo mo hyɛ wo nsa nimdia ahodo nyame wo dia gigya wo ma no ma yɛnyina kwanya na yɛnkyɛ na nso yɛn so atiefo so eba yɛnyina no yɛ tasetase bi yɛne afoforo kyɛ yɛa wo bi ebetimi dia ka ho na aboa kyerɛ na nyimre awurade esan se abusa wo Jesus Christ din mu amen onyame nka ho na onhyira onyame mmoa se nsema yɛate ne no wo nso you pass it on, you share them with your friends so that be education no ebeto aso saa nti nyame adma next week ebehia mu ewo ha bio ene ye ne akramo no nyame nka mu nyina ho